Hi mamas, it's Jillian from Truly Mama, and I am coming to you from my son's nursery this morning. We hear you, and we realize that a lot of you are really worried about what this coronavirus pandemic means for you and your little ones and your families. But perhaps among all of us mothers, those who this is the most difficult for are those new and expectant mothers. So that's why we've taken the time to sit down with Dr. Kristina Arion to get right to the source. We asked her a lot of these questions that we've been hearing from you to clear up the rumors, put your anxieties to rest, and give you some really great information to hopefully make you feel a little bit better. So without further ado, we want to get right into this interview. We hope you'll find it useful, and we look super forward to connecting with you soon. Stay safe. Our first question for you, Kristina, is if I am a pregnant woman and I suspect that I have coronavirus, should I be going to the emergency room? Should I be going to labor and delivery? Or should I be going through those typical triage channels that provinces and governments alike have set up to treat people who suspect that they may have coronavirus?
First of all, it really depends on what your symptoms are. The main symptoms are fever, cough, and shortness of breath, as we know. And if you have those symptoms, we actually recommend that you stay at home. So everyone knows that we want people to stay at home because most patients that get the coronavirus have very mild symptoms and the infection rate is quite high. So if you think you have it and you only have fever and cough, stay home. However, if you do have symptoms like trouble breathing, persistent chest pain, or you feel really lethargic and your lips are blue, those would be reasons to go to the emergency department. So you would go straight to the emergency department if you have those symptoms because an obstetrician won't be able to manage your respiratory symptoms. So you go over there and you're triaged over there. If in pregnancy you think there's an issue with your baby or if you're in labor, yes, go to labor and delivery. But if it's respiratory symptoms related to coronavirus, you want to go to the emergency department.
Our next question is, are pregnant women considered to be high risk in terms of those who are most vulnerable if they do get coronavirus?
Pregnant women are not more susceptible at catching the virus, but if compared to the non-pregnant population, they are at a higher risk of developing more severe symptoms. We know that pneumonia, for instance, in pregnant women, it brings more morbidity and mortality than to a non-pregnant woman, and sometimes 25% of pregnant women with pneumonia have to be hospitalized. Coronavirus can have, like I said, a majority of mild symptoms, but can progress to severe respiratory symptoms as well. And at that time, because of the changes in pregnancy to the respiratory system, pregnant women may develop more severe symptoms. It is, however, reassuring that any of the women that have had coronavirus in pregnancy, from the reports that we've seen from China, they have all survived. There have been no current deaths that we know of.
So broadly, what does it mean if I'm pregnant and I get coronavirus?
It really depends on severity of illness. If you have just fever, cough, and some mild respiratory symptoms, you stay home, you hydrate, you sleep, rest, eat well, take some Tylenol for your fever. If these symptoms get worse, those would be reasons to come to hospital.
Is it possible for coronavirus to hurt my baby before I deliver?
As of today, we don't have any evidence that there's vertical transmission, therefore the virus being contracted in baby while still in the uterus. And if a mom has coronavirus and she self-isolates for 14 days and is well after, the only thing that we would do in the antepartum period would be increased surveillance. So that would just mean more ultrasounds to monitor for growth and for fluid in the amniotic sac. There's not enough data out yet to know if those things are affected once a mom has had coronavirus, but we would just do closer monitoring for the fetus.
So how can I be treated if I have coronavirus and I'm pregnant? Is it the same as people who aren't pregnant and get coronavirus?
Very good question. So treatment for coronavirus right now is supportive. We don't treat with antivirals. We don't treat with antibiotics. It is, like I said, sleep, rest, fluids, eating, oxygen as needed. If you develop severe respiratory symptoms, then you may need to go on a ventilator and in a negative pressure room. So you can get essentially all the same treatment that anyone with coronavirus would get. And then your obstetrician or your family doctor, whoever is following your pregnancy, would just monitor the baby. And this would be done with auscultating for the fetal heart, just to make sure that the heart rate is still present and at a good rhythm. But otherwise, you would receive the same treatment as anyone else with coronavirus.
So what does it mean for me specifically if I'm pregnant and I have an underlying health condition like diabetes or asthma and I get coronavirus on top of it?
Some patients with, let's say, high blood pressure, heart disease, diabetes, where your immune system is also a bit lower, if they catch the virus, they may get sicker. Currently, there's no studies on asthma and coronavirus that is out. However, we know that coronavirus can cause respiratory symptoms and may cause like an asthma type attack. So if you do have diabetes and if you do have asthma, you may get sicker. But unfortunately, I don't have any evidence to draw on this yet.
So this is perhaps the biggest question on the minds of mothers all across North America. If I am pregnant and I go into labor during this pandemic, will my partner be able to go to the hospital with me for the birth of my baby?
You are allowed to have one support person with you in the hospital, so it can be whoever you want it to be, your partner, your parent. But at this time, we are only allowing one person to be with a woman during her hospital stay, and that's from admission until discharge. And that's what I know from hospitals across the country. Some places may do it differently, but essentially it's one support person per pregnant woman.
Our next set of questions is for mothers who have newborn babies. And our first question is, what can I do to keep my newborn baby safe from coronavirus?
So you have to be careful with what you're doing and who's around baby. So of course, practice good hand washing. And if mom has COVID-19 or if parents have COVID-19, to wear a mask, because as we know, it's droplet and contact that you can contract the virus. So you can still we do not recommend at this time isolating mom from baby if mom does have coronavirus and baby was just born. Otherwise, if you have a baby and then you stay in the hospital for your 1 day postpartum, hopefully you go home after that if everything went well. And then when you go home, stay home. It's the same thing. Don't bring your baby out if you don't need to. Practice social distancing. If people want to come visit your baby, I would recommend only people that you know that have been self-isolating, that haven't been in contact with anyone that has COVID-19. And then the same thing, those people have to wash their hands. And if they do show any symptoms, I wouldn't recommend them being close to your baby.
If I have coronavirus, am I able to breastfeed?
Right now, the SOGC does encourage women who want to breastfeed to breastfeed. When you are breastfeeding, of course, you have to make sure that you have washed your hands before doing so and that you wear a mask when you're doing it. There has not been any positive COVID-19 in the breast milk that has been found when lots of different women have been tested so far.
Thank you for such thoughtful answers to our questions, Kristina. You can really tell the compassion and care that you have for your patients, and that is absolutely what makes a great doctor. So with that said, what is the number one piece of advice that you would give a new mom or an expectant mother who is really worried about the COVID-19 pandemic?
Being a new mom is probably the hardest job in the whole entire world. And so there's already a lot of new anxiety and stress that comes with being a new mom, in addition to like not sleeping as well and taking care of a baby. So the most important thing I would say in this time with an intense global pandemic happening is try to stay home, keep you and your loved ones safe, and also stay up to date with what's happening, but don't overwhelm yourself with lots of different resources. Keep one or two trusted resources that you have, because it's very easy to be overwhelmed and become anxious. As well, we know that postpartum depression is a very real thing. So it's easy to go into one direction if you feel that this is very overwhelming. So moms, stay home, stay safe, wash your hands. practice social distancing, be proactive, and keep updated with information from bodies like the Society of Obstetricians and Gynecologists of Canada. Make sure that you have good support at home, and stay safe.
A huge thank you to you, Kristina, for taking the time to answer our questions today. And a huge thank you to you if you watched this video. Make sure to leave us a thumbs up, hit that subscribe button, and head on over to trulymama.com for lots of other great tips and advice on all things motherhood. Be sure to check out our Instagram page at trulymamaco for great daily tips, motivation, positive content to fill that timeline. Until next time, guys, see you later.